So back in February, I elected to have my gallbladder out. I say elected because it was considered an elective procedure, even though it was linked to a litany of other GI issues. But I'm gonna be bitter about that on another day. My point is, I didn't plan on having surgery this year, and I certainly wasn't prepared to pay for it. I knew if I was going to have this procedure, I needed to shift my thought process from patient to consumer and make financially conscious decisions around the cost of my care, especially with a higher deductible insurance plan, like many of us now have. In fact, high deductible plans in the insurance market and the employer marketplace have increased to 67% since 2010, and over half of US workers have a deductible greater than $1,000. Thankfully, I work in healthcare, so I knew how to make decisions around the cost of my care while still ensuring I was receiving high quality care. And I steered the ship with my providers on where I had my labs, imaging, and procedure performed. In the end, I was able to save myself well over $2,000. And I achieved this by comparing actual cost data from facilities in our region that have comparable quality. Now, this is a multifaceted approach because there are many things you need to take into consideration, like your deductible, your co-insurance, in or out-of-network benefits, and your out-of-pocket maximum. But here's the thing. If you have not yet met your annual out-of-pocket maximum, you will likely always be paying towards something. I had 2 outpatient diagnostic tests as part of this process, an ultrasound of my abdomen and a CAT scan of my abdomen. The cost for me to have both tests at Area Facility A was about $380. The cost for me to have the same tests at Area Facility B was about $1,200. Now, knowing I have a higher deductible health plan, and I had applied hardly anything towards my $5,000 pocket maximum, I had to ask myself, which of these would I rather be paying toward? Check out another example, which many of you may find familiar. A typical session of physical therapy after your initial evaluation is about 45 minutes of exercise and 15 minutes of hands-on manipulation with the therapist. That hour session at Area Facility A is about $150. That same hour session at Area Facility B is about $845. But imagine you're having that hour session 2 times a week for 6 weeks. Which would you rather be paying toward? We participate in the human experience of consumerism every day. We choose what clothes we wear, what cars we drive, often with the intent of finding a high-quality, low-cost purchase. Let's say you're going to buy a car. There is a trusted book of a certain color that allows you to compare the price, quality, and reviews of a potential purchase. Having the knowledge gained from that book, which is now a website and an app, puts you in the driver's seat of making informed decisions. All of this got me thinking, are patients doing the same thing and taking themselves to the consumer level in their healthcare experience? Some are, but majority aren't. Instead of patients with high deductible health plans price shopping for lower cost care, they are statistically avoiding care altogether, making the case that we could start to see a sicker population with more complex care needs. The low percentage of the population who are price shopping are doing so for what are considered to be some of the most shoppable services, like CAT scans, MRIs, colonoscopies, and mammograms. A recent Harvard study showed a direct correlation between patients price shopping on the procedures I just mentioned and having them performed within 180 days of their search. So what we find is that patients who price shop for lower cost care are more likely to close the loop on having preventative visits, translating to better health outcomes. So who is on the hook for educating patients about their ability to shop around? It's that age-old saying that people don't know what they don't know. In almost every conversation I have on this topic, and in almost every white paper, blog post, and survey I read, there is an overwhelming response that patients are just doing what their physicians and advanced practitioners tell them to do, and where they tell them to go. A typical provider-patient conversation goes something like this. You need to have a test done, and I'm sending the order to area facility A. Or oftentimes, the staff is just picking the first facility that pops up in the electronic medical record without any discussion around cost or quality. So the patient goes blindly on their way, not questioning their provider's order. And why would they? We trust our healthcare providers, as we should. But as the expectations of our society change, so must the items we trust our healthcare providers with. There is a big push in the movement towards healthcare price transparency for providers to engage in cost discussions with patients. A New York Times series titled Paying Till It Hurts shows that 80% of patients want their providers to discuss cost with them. Understand, though, this is a difficult conversation for providers to have. And I'm certain majority of them would argue that this is not what they got into medicine to do. And I'm not advocating that there needs to be this in-depth dollar and cents discussion about everything they do. There are those of us in this industry who are better suited for those discussions. Quite frankly, we love having them. There does, though, need to be a mutual understanding that cost, while still retaining a focus on high quality, should be part of our discussions. And we as healthcare consumers should be helping with those discussions. Now that said, all of this doesn't have to happen in the exam room or at the front desk of your provider's office. There are multiple online tools, starting with your insurance payer's website, where you can compare cost and quality. Outside of the insurance arena, the industry is seeing a significant surge in healthcare price comparison tools and apps, which aggregate claim and facility published data based on region. Similar to that automobile comparison tool I mentioned earlier, you can pull out your phone right now, log on to your insurance payer's website, or search for a healthcare cost estimator, and find the best price option in your region. If my call to action is that we are engaged consumers in our healthcare experience, I feel that I'd be remiss in not mentioning that this goes far beyond price transparency. Being an engaged consumer is not just about understanding cost. Healthcare is undergoing major transformation, largely with the consumer in mind. For example, there's a consumer-based program called Patient-Centered Medical Home. This is a government-issued recognition, and it comes with a set of very stringent metrics. One of those metrics is to hold a percentage of your schedule for same-day appointments. Well, I recently had a friend who woke up sick, and I overheard him call his physician's office, who I happen to know is a patient-centered medical home, and there are many in our region. He described his symptoms, as we all would, and then I heard him say, "Oh, okay. Well, if it gets any worse, I guess I'll go to the urgent care." He told me he couldn't be seen for 3 days. When I had him call his physician's office back to let them know that he was aware that they're a patient-centered medical home, and he would like a same-day appointment if it was available, he was seen within hours. Knowledge begets power, and we as healthcare consumers have the opportunity to be so powerful. I encourage you to ask questions, engage with your providers, shop around, and above all, search for your human experience in healthcare. Oh, and remember all that money I said I saved? It went toward a really awesome trip to Mexico. Thank you.